Today was President Trump's first day back at the White House after being released from the hospital. His doctor reporting the president had a restful night and continues to do well. The president himself tweeting today that he's feeling great as he's now facing criticism for downplaying the severity of coronavirus since getting out of the hospital.
Don't let it dominate you. Don't be afraid of it.
It is a message healthcare professionals are concerned may be misconstrued. Our Cameron Polam speaking with local doctors about what they hope people take away from the president's diagnosis.
For him to say, don't worry about it, we've got great drugs, it's not a thing to be afraid of, and in particular, I feel better than I did 20 years ago, is such a horrible, horrible message.
Dr. Mortaza Akhtar, an emergency room physician and someone who's treated hundreds suffering from the coronavirus in Arizona, attempting to understand why the president would be so cavalier with his words Monday.
I know there's a risk, there's a danger, but that's okay. And now I'm better, and maybe I'm immune. I don't know.
The president released from Walter Reed Monday evening, returning to the White House and promptly ripping off his mask for the cameras, flaunting isolation protocols, delivering a message on Twitter that stunned many in the medical community.
If people take that message to mean I'm going to do what I want and have parties and not wear masks, like so many have been doing, it's really a horrible message.
Don't let it dominate you. Don't be afraid of it.
Dr. Akhtar agrees people shouldn't live in fear, but points out a major flaw in the president's message.
But to say that, listen, we'll just treat it, is so preposterous. The best treatment for any disease is prevention, just not getting it.
The message that he gave neglected to even mention really the prevention side of the equation, which to me is, saves more lives than the treatment end.
Will Humble says clearly there are more treatments available at this juncture, but masks, social distancing, and proper isolation protocols are making the biggest difference.
If we want to have commercial activity continue over the next few months until we get the vaccine, if we want our kids to experience in-person school, then we're going to have to do the prevention activities, the simple ones, really.
He says the president's actions go against every public health message passed to the public, but adds he doesn't think it will make that much of a difference.
I'm not going to overstate how much harm this does because I don't really believe that message is going to be persuasive with very much of the public. That's just my honest assessment.
I'm Cameron Polam, ABC 15, Arizona.